welcome to another episode of THB's podcast. Today in studio we have with us Dr. Suhail Chughdai, orthopedic surgeon in London, UK, and telehealth innovator and expert. Thank you so much for being here with us today, Dr. Suhail.
It's my pleasure. Thank you, Zarmina.
Dr. Suhail, today we're talking about clinical telemedicine. Can you tell us a little bit about that phrase before we dive deep into it?
I think the video conferencing between doctor and patient is now taking off. People are managing medical conditions through that. But that is not enough. That's an opportunity where we dive deeper into that. The clinical telemedicine is where we have a clinical decision support system, the disease management system, the patient education system, the electronic medical record system, the prescription system, the practice management system, all built in one interface. So it's a single code where you don't have to download anything, and that constitutes our clinical telemedicine software. That has been my passion for the last 13 years, and now at THB, at the Health Bank Global, we are taking it forward as a team.
So basically, it's a lot more than video conferencing.
Oh, yes.
Right.
Oh, yes.
Exactly. And I think that's maybe, like you said, that's become the norm a little bit now. Perhaps, supported by the pandemic, people became comfortable to have those consultations online, on video. But there is a big gap in video conferencing and clinical telemedicine with all the features that you just mentioned. Thinking from a physician's perspective, how can we close the gap between a physical examination being conducted through a clinical assessment or clinical telemedicine? That's what a physician's concern would primarily be. How can we cover that gap?
Well, first of all, there are many specialties where physical examination is not of paramount significance. Take example of psychiatry. That is again an area where a lot of conversation is needed, and thinking of the convenience to the patient and to the consultant and to the whole health industry, telepsychiatry is one of the areas where a lot of things can be done. Then there are many other specialties where the reliance on the investigations, the blood tests, is very heavy. Clinical decisions are pending blood test results. So which means that if the patient has the blood test result conveyed electronically through the clinical telemedicine system, the doctor is able to make a decision during a call. So that is like endocrinology, like audiology, like, for example, take other specialties. Even if you take ophthalmology, a lot of retinoscope results, the ophthalmologists are waiting for retinoscope results to confirm their visual findings. So these results at times are only required after a physical visual examination. And then comes those investigations where we make clinical decisions only on investigations. For example, orthopedics, X-rays, MRI scans, cardiology, echocardiograms, ECGs. So there is a heavy reliance on medical information in the form of investigations, which can all be part of the electronic medical record system. One thing I want to mention here, there is a text or data-based electronic medical record. But in our clinical telemedicine system, we have put a portal where there's a video and also image-based electronic medical records. So a patient can send a clip of a child limping to me. My mothers do that when I do in my practice. My child is limping. So I examine their gait in a far more repetitive way. I have an opportunity to analyze that at still frames as well. That where is the child exactly limping? So this advantage of having video calls plus the information in imagery and videos. For example, if a person sends me a picture of a skin rash, or I can take the picture live during a consultation. So this advantage to physicians is enormous, and they must not lose this by just video calling.
So how do you see clinical telemedicine changing the landscape and approach to healthcare in general?
Zarmina, the decision time to intervention is decreasing. The doctors are able to intervene, make critical decisions much earlier if they use telemedicine. The reason is the patient can get to them today, now. So they are able to make a clinical decision today and now. And that advantage wasn't there before. The patients had to wait to take an appointment, to go there and get seen. So that is one big advantage. The industry will be reshaped. The quality of the care will improve. The physicians will be more in demand. People who think the telemedicine will replace them, no. But it will replace those clinicians who don't use telemedicine. It will not replace clinicians. But those who don't use telemedicine, somebody junior will come, offer the services to patients, and the senior guy will be less in demand. So it's a necessity for everybody to learn to become even and then enter a competition.
Dr. Sohail, before we close out the session, I'd love to hear from you your thoughts on the future of telemedicine and healthcare overall in relation to genomics, AI in healthcare, and precision medicine.
You know, I'm glad you mentioned AI, artificial intelligence in healthcare. This is such a blessing that it has come up. The artificial intelligence is a fast thinker. It's a third person in the room. It's a nurse. Currently at the Health Bank Global, we are working on a software where I have put the artificial intelligence front end to telemedicine, which means that the artificial intelligence will take a history of the patient. What is your pain, like shoulder pain, how often, what are the aggravating factors, what are the relieving factors? So the nurse will ask those questions, preventing the consultant's time, and help him make two things: a clinical decision and to empathize with the patient. So more time for empathy rather than spending time on repetitive questions. And then the data will be collected in a very formative way, which can be used for disease surveillance. Artificial intelligence, telemedicine, they will be nurse and doctor in the future. Precision medicine, one step forward. Genomics. So at the gene expressions, the gene study will tell you that person is, let's say, susceptible to cancer, lung cancer. So what is the environment that person should be prevented from to prevent the expression of the gene, like smoking, like a dusty environment living. And that is a precision medicine that you, and also the side effects of the drugs. So for example, we give antibiotics for same condition. So which antibiotic should be suitable for this patient? That is a precision medicine, because the genes will tell you what is more effective antibiotics for that person as well. So we are heading into a stage where telemedicine is going to be the medicine. And I really want to repeat that. Telemedicine is going to be the medicine. Thank you.
Thank you so much, Dr. Sohail. There's so much to look forward to. We're so excited as THP and as industry players. And thank you for this session. It was very helpful.
It's my pleasure. Thank you, Zarmina.
I hope you enjoyed this segment today. Stay tuned for more from the Health Bank Global.